everybody. Welcome to today's episode of Being Me, where we're honored to have the opportunity to speak with Jennifer Epstein, Director of Education and Outreach at Song for Charlie. Song for Charlie is a national family-run nonprofit charity dedicated to raising awareness about fentapills, fake pills made of fentanyl. Jennifer Epstein joined Song for Charlie after losing her dear 18-year-old son, Cal, to a fake pill in December of 2020. Jennifer worked with Beaverton School District to develop their Fake and Fatal campaign, the first known fake pill awareness campaign by a school district in the country. Jennifer is now Song for Charlie's Director of Outreach and Education, responsible for developing resources to help spread awareness and reach out to organizations that work with kids. Jennifer brings with her 20 years of both Fortune 100 and startup operations experience, and over 12 years of working with schools and youth. In this episode, we will learn more about the epidemic of fentanyl, how it's impacting teens, Jen's personal connection to the impact of fentanyl on real families, and her work with Song for Charlie. Jennifer, anything you'd like to add?
Thank you, Neha. It is a pleasure to be here, and I don't have anything to add. I think you covered it very well.
We like to start our Being Me podcast by asking you to tell us a little bit about teenage Jen. Did you have a nickname? Were you confident? Were you shy? Did you participate in school activities, sports, debate? What was teen Jen like?
I think my teenage years started out pretty typical. I was kind of a studious kid, and I had a group of friends who were also studious that we liked to hang out with. We would go to, the school sports events, the basketball games, the football games, soccer games. We like to go to concerts and just hang out at each other's homes, that sort of thing. I was pretty confident and involved. I grew up swimming and was on swim teams year round and was involved in yearbook and a few other school clubs. But honestly, my world got turned upside down the summer after my freshman year when I became sick. And ultimately, I was diagnosed with an autoimmune disease called Still's disease. And that caused me to miss a lot of my remaining high school years. So I was tutored at home and had a hard time staying in touch with my friends. So my high school experience was not ideal and it was very atypical, but I made it through and it gave me a different perspective about what is important in life and what I can control and not control at a very young age.
I think a lot of people hear about fentanyl in the news and may see it on social media, but they aren't entirely sure what it is or how it differs from other opioids. Could you maybe give us an overview of these issues?
Fentanyl is really the next phase of the opioid epidemic, and it is dramatically different than anything we've seen before. What has happened is that the Mexican cartels are looking for a profitable way to meet the demand for illicit drugs. In the past, a lot of the illicit drugs came from redirected product that was taken from pharmaceutical companies or pharmacies or from doctors that overprescribed. And so they were able to get that legitimate pharmaceutical drugs and get that out onto the street market. Eventually that got shut down. And then cartels started making heroin, cocaine, and drugs from the poppy plant. And of course, that is expensive to make. And so the cartels are looking for cheaper ways of doing things and landed on making a synthetic product called fentanyl. And fentanyl, it is a powerful synthetic opioid. It is legitimately used in hospital settings every single day. It is something that is used in surgeries on a regular basis to control pain for end-of-life care. It has a number of uses and has been used in the US since the 50s. Fentanyl is 50 times more powerful than heroin and 100% more powerful than morphine. And so it's very powerful and relatively cheap and easy to make, at least when you're comparing it to something that is based on a grown crop like heroin or cocaine or morphine, which all come from the poppy plant. So basically, the Mexican cartels have started making fentanyl, but they're not making it in a pharmaceutical company or in a pharmaceutical setting. So it is a very powerful drug that they're making, and there's very little quality control. So the fentanyl that they're making and putting out into the market in the form of powder, it's very difficult to know what the dosage is. In addition to it being very strong, as I said, it's being put into pills and being deceptively sold as pills that are familiar to many young people today. So it is being sold as Oxycontin. It's being sold as Percocet, basically like a lot of prescription pills that they're familiar with. Because fentanyl has been added to the street drug scene, we've seen a dramatic increase in adolescent deaths between July 2019 and December of 2021. The number of adolescent deaths involving illicit fentanyl has increased by 182%. This is at the same time as we know that illicit drug use is going down in adolescents during that same time. So to see such a dramatic increase in deaths while drug use is going down just points to a dramatic change in life.
This is just so alarming and important and top of mind for me as a physician, because I know that, as you said, fentanyl is dramatically more dangerous. And as you said, it's extremely powerful. It's easy to access. It's hard to dose. And now it's deceptively being put into other drugs. Do you have any thoughts on how teens can protect themselves from illicit fentanyl, especially when it's found unexpectedly as part of another drug?
You know, I think that teens need to educate themselves and understand what is going on. They need to understand that there are pills that are circulating out there, being sold on social media or being passed from friend to friend, that are not what they think they are. So if they get a Percocet, an Oxy, even pills that are not being marketed as opioids, so Xanax, Adderall, those often are being laced or being made of...
Even Adderall, which is prescribed commonly for ADHD.
Yeah.
But you're saying when it's found on the street, it can be laced with fentanyl. That's fascinating. I actually had no idea, and that's very terrifying at the same time.
Yes, and it is happening. And we know that it is not unheard of for teens to pass prescription pills from friend to friend. So there are legitimate pills being passed, but you just don't know if the next pill you get could be something that is made of fentanyl. Young people need to understand that anytime that they reach for something that is not from a pharmacy in a bottle with their name on it, then it could have fentanyl, whether it be a pill. Also, fentanyl is being put in cocaine, heroin, MDMA. There are also reports of it being found in marijuana and vape pens. It is not widespread, but it is something that is a possibility, and we need to keep an eye on that as well.
Wow, that makes street drugs even more deadly than ever before. Why would people keep sourcing them, even though it's killing their customers?
Honestly, the cartels are in it for the money. If the makers of these drugs kill a few customers, they're really not too worried because often there's no consequences for them. The people who are making the drugs, they make it and it can pass hands a half a dozen or a dozen times before it gets to a person who sells it on Snapchat or whatever means they're going to sell it. And so they're not seeing the deaths, and they know that if they keep on producing this, that there's going to be a demand. So they're just looking for customers and they're looking for money.
Clearly, the risk associated with death is catastrophic, but what are some of the other risks that are associated with using fentanyl?
The people who don't die from fentanyl, certainly not everybody is dying from fentanyl, but the people who don't die from fentanyl poisoning risk heading down a very difficult path of substance use disorder. People who develop dependency to fentanyl tend to suffer more severe symptoms, more withdrawal symptoms whenever they do try to stop. And treatment for fentanyl addiction is much more complicated than addiction to other opioids. From doctors that I talk to, it's just very complicated and not an easy path to be on.
That makes sense. I'm wondering if you could share a little bit about how to tell if someone has taken fentanyl, what you should do if you suspect that they have, because I imagine that teens listening might at some point come across maybe another teen or even an adult who they're worried about. And I know that the FDA recently cleared Narcan for over-the-counter use, which is an antidote or reversal drug to opioid overdose. So it's really, really effective medication. So I'm wondering if you could talk a little bit about what to look for, and then also why you think Narcan and its availability over the counter is a game changer and such an important decision by the FDA.
You're talking about Narcan, which is also known as naloxone. Narcan is actually the name brand for naloxone. So let's talk about the case where somebody takes fentanyl and overdoses. So if somebody is overdosing on fentanyl, typically it's not necessarily a dramatic event. It can look a lot like falling asleep. Fentanyl interrupts the natural drive to breathe. So their breathing is going to slow down. They often fall asleep or lose consciousness. So their body may go limp. Sometimes you'll hear choking or gurgling sounds. And that's their body trying to breathe, trying to get more air in because the fentanyl is suppressing the drive to breathe. The person could turn blue or pale, or over time, their skin is going to get cold. And if you look at their pupils, they're going to have very small pinpoint pupils. If you do see somebody who you suspect is having an overdose, it is imperative that you take action immediately. You can't survive without air for very long. So the first thing to do is administer Narcan or naloxone if you have it and call 911. 911 will most likely have you start CPR. What naloxone does is it's the only drug that's available that reverses the effects of an overdose. So what it does is it binds to the brain's opioid receptors and knocks off the naloxone. And so it reverses the effects of the overdose for a period of time. It only lasts for about 30 minutes or so. So even if you do administer Narcan and the person comes around again, it's super important to get the medical attention because they could overdose again. Naloxone, like you mentioned, the FDA recently approved for it to become over the counter. So beginning later this summer, it will easily be available in drugstores as well as perhaps gas stations and convenience stores. It will be available everywhere and it'll be relatively cheap. The price will come down, especially with it becoming more available. We encourage everybody to have it on hand, whether or not you yourself would be perhaps considering using an opioid or not. I think having it on hand, you could save anybody, a passerby, a friend, anybody in your household or who you live with. You don't know when it might be necessary. And so you want to have it on hand or in your car, in your purse, at home, wherever.
Such helpful education and advice. I'm wondering if you can share with our listeners some of the warning signs of fentanyl use disorder, which is really the technical term for addiction. How can somebody get help for a substance use disorder if they're using fentanyl, or how could they help another friend or colleague or somebody else who they see struggling with it?
The signs of opioid use are sometimes obvious, sometimes they could be subtle, but some of the signs to look out for is, if a person is isolating from their family or friends, or hanging out perhaps with a new group of friends. They sometimes will have mood swings or unusual changes in their behavior. Sometimes they change their sleep habits or lose weight, maybe not take as good care of themselves. Maybe they're not doing as well in school, perhaps stealing from their friends or family to pay for their habit. Those are kind of signs. They're not always obvious. And so you kind of have to look out for it. And, I think that if you do suspect somebody's using, it is more important than ever to try to get help. With fentanyl, young people are dying, even sometimes with their first time experimenting with the pill or with the substance. And so, it is no longer the case that people can go down the path of substance use and live for decades using. It is much more dangerous than before. So I think it is a hard situation to be in if you do think somebody is using, but I think that it is something where it is important to step forward and have compassion and directly talk to that person and share your concern. Ask the friend if they're all right, if they need help, and encourage them to get help. And if perhaps you can offer to be in support as they're getting help. Like I said, it's a hard thing to do. We tend to let people mind their own business or not want to get involved. But we need to remember that sometimes being a good friend means not holding secrets and not holding back and being able to share concern in a way that shows that you care for that person. If a person is not willing to get help, then I think it's important to go to a trusted adult, whether it be a school counselor, a teacher, a parent, and share your worry, even if you have to do it anonymously so that you can try to maintain that friendship. But I think it's important to not just ignore it. If you talk to your friend and they don't want to get help, it's important to pull an adult in or somebody who can help and see if you can get that person some services so that they can take steps to get healthy again.
Thank you so much. That's really helpful. How can teens protect themselves and their friends from the dangers of fentanyl? And what steps should teens take if they're offered fentanyl or other drugs, or if they're being influenced by their friends to take them or anything?
The first thing that teens need to understand is that most of their peers are not using illicit drugs. We talk about fentanyl a lot. It's in the news a lot. And so the perception may be that it's out there and everybody's doing it. But in reality, illicit drug use in young people has been trending down for 20 years. And less than 10% of teens are using illicit drugs, not including alcohol and marijuana. When I say that, I mean pills and cocaine, heroin, those types of things. And actually, I think it's much less than 10%, 6% or under. It's very low. Keep that in mind, even though you may be seeing this on TV and movies, et cetera, the norm is to be clean and not use illicit drugs. So keep that in mind. Stay educated on fentanyl and the illicit drug supply. Fentanyl is one of the biggest problems right now, but there are other synthetic drugs that are coming down the line that we need to be aware of and keep an eye on. And know the signs of the overdose. As I said, it looks a lot like sleeping. It's not necessarily a dramatic event. So kind of keep an eye out. If you see somebody struggling, be ready with Narcan and know that you can make a difference by taking steps, administering Narcan, calling 911, and helping a person. Also know that test strips are available. They are a solution that is proposed by our government and are available in many states, but we also need to understand that they don't guarantee safety. So educate yourself on test strips and their use, and also know that in order to use a test strip, you need to dissolve the substance that you're testing so that if anybody ever offers you a pill and says that it's been tested, they're lying, because in order to test a pill, you would have to dissolve it in water and put the test strip in the water and see what the test says. So just know about test strips and their limitations as well.
It's really interesting. I had no idea about test strips. It's really valuable education.
Yes, test strips are important, but it's important to know, really educate yourself on test strips and know where they're used and what their limitations are. They don't test for all drugs. They don't test for all of the variations of fentanyl, and they also don't test for other drugs that might be coming down the line, like nitazines or xylazine. So they serve a purpose, but they don't guarantee safety. And also just know that if offered drugs, that the safest route is to decline, and just know that the only safe pill is a pill that is obtained from a pharmacy in a bottle with your name on it. You can make a joke of it. You can just say, hey, my parents drug test me. There's a million things that you can say to decline, and that's okay. I encourage people, don't be afraid to report dealers on social media. There's a lot of dealers on social media, and I know they pop up. Unless we start reporting them, they're going to continue to be out there.
Very good advice. I want to talk a little bit more specifically about Song for Charlie. What's the mission, and how does it aim to prevent fentanyl-related deaths?
Song for Charlie's mission is to educate youth and parents about the dangers of fake pills made of fentanyl and other synthetic drugs. In the fall of 2022, Song for Charlie did a national survey that revealed that only about 36% of high schoolers are aware of fake pills made of fentanyl. That means that a full 2/3 of high schoolers really don't have the information that they need to make a good choice if they're ever at a party and offered a pill or tempted to buy a pill on social media. So we think that young people today generally make good choices, and we want to empower them by giving them the information they need to make good choices.
I'd love to hear more about how Song for Charlie got started too. What inspired the founders to take action? And Jen, how did you get involved in raising awareness on the issue as well?
Well, Song for Charlie was started by Ed and Mary Ternan. In May of 2020, they lost their 22-year-old son, Charlie, to a fake pill. He was a college senior and was getting ready for a college interview, had back pain from a surgery that he had a couple years before. And a friend was getting a pill on social media and asked if Charlie wanted anything. And Charlie asked for a Percocet and instead got a pill made 100% of fentanyl. And so Ed and Mary were taken off guard. They hadn't heard anything about fentanyl and fake pills. And when they looked into the situation, understood that the drug landscape and everything that was going into this problem, they realized that this was a huge problem that would take years to fix. There's teen mental health. There's the supply issues. There's a lot of issues around the drug laws and the pervasiveness of just general drug use in the US. So there's a lot of issues that go into this. And they knew it was going to be a big problem to fix. And they realized that nobody was warning the young people. So that's why they created Song for Charlie. They just wanted to warn young people about today's drug environment so that they understood what was going on. I became involved in Song for Charlie after I lost my son. As you mentioned earlier, I lost my 18-year-old son, Cal, in December of 2020. Cal was, we thought, a pretty average kid, and he was a good student, very involved in school. He loved school theater and was a lifeguard and a swim instructor to young kids, and overall seemed to be on a good path. His senior year, we realized he was using marijuana and had some discussions with him. Later that year, we realized that he was still using marijuana, and he disclosed to us that he was using it to deal with his anxiety, and he was having problems eating, and he thought it would help stimulate his appetite. So, of course, red flags went off and we got him help. And this was during the spring of 2020, during the pandemic. And things were hard for him because school was shutting down, but he really wanted to turn himself around and he knew he needed help. And we were proud of him. So we found him a psychiatrist and a therapist and seemed to be on a good track. And in the fall of 2020, we decided that a good thing for him would be to kind of move into a new environment, continue his mental health with therapists and counselors, and go off to college. And he did that and came home for winter break and was home for a couple days when we found him unresponsive in his bed. So honestly, we never...
Oh my gosh.
Yeah.
Oh, Jen, I'm so sorry.
Thank you. We suspect he was trying to help with his anxiety. He had expressed that his medicine wasn't helping the way he wanted. But honestly, we don't know if he was just trying to have fun. We don't know. So that's how we got thrown into this, is that we lost our son, Cal, and learned what was going on. And just really, my husband and I felt the need to share our son's story because we know that Cal did not know what he was getting. The day before he passed, he Googled what a safe dose of oxy was for his weight and how it would react with his anxiety medicine. So we know he made a poor choice in choosing to reach for a pill, but he didn't know what was in there. So we want to use Cal's story to make other people aware of the risk.
Thank you for sharing that. What resources does Song for Charlie offer to teens, and how can they help prevent these fentanyl-related incidents?
Yeah, we really think it's important for kids to understand what is going on. Knowledge is power. And first of all, take care of yourself, take care of your mental health. So at Song for Charlie on our website, we have some sections around healthy coping. We call them skills over pills, farm over pharma. So we encourage young people to take care of your physical and mental health. Think about what's being put in your body and make sure that what you're putting in the body are things that are healthy. And that's one of the reasons why we love BeMe and what you're doing, because we think that being aware of your mental health, taking care of your mental health, and being resourceful and being willing to try resources that are out there is so important for young people today. So we want young people to be focusing on their mental health. We also provide lots of content and material for educating people, young people and parents, and anybody working with young people with education material related to fentanyl and synthetic opioids and anything related to the drug scene, so people understand what is going on. So we have videos and other education material. We have social media sites where we do regular posts and encourage people to share and forward and comment and everything to help us to get a further reach. We have something called a Fentanyl Fight Club, which is a section of our site that is really aimed at young people to help spread awareness and resources for spreading awareness. And also, we're planning to expand that to offer young people resources to help train other young people. So peer-to-peer kind of training program that we're working on getting in place. We also provide various resources for schools and federal agencies. We have a middle and high school toolkit that schools could use. We have a college toolkit that universities could use, or anybody in a university setting. So everything we have is free and fact-based and available to use for anybody who wants to spread awareness.
Wow, what a robust program. And really, really important work that you're doing. And I'm not aware of other programs that are doing it in quite the same way. So just kudos to you all.
Thank you. Thank you.
How can teens or schools get involved with Song for Charlie and support its mission to spread awareness about the dangers of fentanyl? Where should they go to learn more about how to get involved with this stuff?
First of all, I just want to acknowledge that teens have a lot of influence, not only with their peers, because definitely teens listen to other teens, but teens have a lot of influence over what adults are doing or what programs are offered. So I think it's important for teens to get involved if this is something that they're interested in. First, I think the easiest thing to do would be to follow us on social media and share and like our posts. I think that spreading the word on social media is an easy way to reach other teens. I think it's important to talk to your family and friends about what is going on. Share with them what you've learned, share with them what you know, and ask questions, and make sure that your friends and family are hearing about your concerns about this issue and are learning from you of what you know. And don't be afraid to speak up if you see something that concerns you. As I said, if you see dealers on social media, you report them. If you see somebody struggling, it's important to speak up. The more people who speak up about things like this, the safer our communities are going to be. I think teens can go to their school administration and ask them what they're doing about this problem. Unfortunately, there's a lot of schools who are still struggling to figure out what to do and don't have programs in place for their students. And so I think if the administration hears that students want to hear this information, they're going to ask to act quicker. And I think you can also share the Song for Charlie middle school and high school handbook with your school, because unfortunately schools, like I said, they're struggling. They don't know where to go to get this content. You can share with them the Song for Charlie content, which might help them to get started. I encourage you to follow our newsletter. We are always putting out new content. So anybody who wants to kind of keep up to date on what we have, you can follow our newsletter or follow us on social media again.
That's a great idea. And May 9th is actually National Fentanyl Awareness Day. And BeMe is proud to be a partner for this fentanyl awareness campaign with you all. Can you tell us a little bit about the National Fentanyl Awareness Day and then some of the programs and webinars that are taking place that day and how our listeners might be able to access them?
So National Fentanyl Day is a day of awareness. Our goal is to make people across the U.S. aware of the fentanyl crisis, including the impact it is having on youth. I think that the youth impact of the opioid crisis is something new and that a lot of people aren't aware of. And so we're trying to make sure that is something that everybody knows about. And during National Fentanyl Awareness Day, we have various partners from around the country who will be spreading awareness in their communities. Companies, schools, any organization who's interested in helping can sign up to be a partner. And one thing that we are doing is, at National Fentanyl Awareness Organization is hosting a series of webinars. I believe there's 5 webinars over the course of the day. And one of them, BeMe is involved in, and that one is called What Parents Need to Know, with Dr. Hina Talib, Dr. Scott Hadland, and BeMe's Dr. Danielle Ramo. And that is going to be at noon Eastern Standard Time on May 9th. For more information and to plug into that webinar, you can go to fentanylawarenessday.org, or you can follow us on social media, and either way will get you there.
I'm very excited about that one. And I'm also happy to share that besides partnering in National Fentanyl Awareness Day, BeMe's partnering with Song for Charlie to provide fentanyl awareness content in our app. Can you tell us a little bit about what Song for Charlie hopes that teens will take away from seeing this content on BeMe?
We also are very excited for this partnership. We think that BeMe is a great platform to help youth, and we're happy to share our content to keep young people safe. Generally, as we said, that Song for Charlie, we want teens to stay informed. We know that teens generally make good decisions, and we need to empower teens to make good decisions around drug use by making sure they have the most up-to-date information on the current drug landscape. And so basically, we are putting content on the BeMe app to make sure that you are aware of what is going on. The drug landscape has changed since your parents grew up, or even in the last 5 years. There's a good chance that the traditional forms of drug education, your parents, your schools, might not have the latest information. So getting information can be hard, and we want to be your go-to resource, and BeMe is helping us to get that out there.
Before we go, Jen, what advice would you like to leave our teen listeners with today?
I would just say, remember that life can be great, but it can be hard too, and everyone faces challenges. You're not alone in your struggles. Remember that if you are struggling, pills and illicit drugs won't solve your problems. Take care of your physical and mental health, and don't be afraid to ask for help. People want to help you, and the world is a better place when we all take care of each other.
I love that. Thanks again, Jen, for being on the podcast today. We really appreciate sharing Cal's story with us and about the good work that you're doing with Song for Charlie to help raise awareness around fentanyl.
Thank you, Neha. It's been a pleasure, and I appreciate being here and the opportunity to share my story and talk to your audience. Thank you.
You can learn more about the BeMe and Song for Charlie collaboration for National Fentanyl Awareness Day at BeMe.com/songforcharlie and in the BeMe app. You can learn more about Song for Charlie at songforcharlie.org. Until next time, this is Dr. Neha Chaudhary, my co-host Hazuri Dhillon, and our podcast producer, Derek Baird, reminding you to keep being you.